Hi, Floppycatters! Please join me in welcoming Andrea Ring, a certified classical homeopath with a passion for both animals and human wellness. Her interest in homeopathy began in 1999 after witnessing its positive impact on her dog, Toby. This experience led her to pursue a career change, graduating from the Vancouver Homeopathic Academy and the College of Animal Homeopathic Medicine. With over 20 years of experience, Andrea combines her knowledge of homeopathy with her extensive background in veterinary medicine. She offers a holistic approach to wellness for both people and their human companions. Andrea, thank you for being here.
Oh,
I was trying
Jenny, thank you for inviting me. I'm so happy to be here with you.
I was trying to remember when was I first introduced to you, and I would guess it was probably on an Ask Julie Anything type of thing, and then she mentioned your name, and then I went to Google it or something like that. But I've heard it so many times since then. But this particular interview happened because I was listening to one of the series that Jeff Grognet puts on, and
Hmm.
you were featured for homeopathy for cats. And your background in broadcasting, just like your voice, I honestly think that you should do like meditation rituals or something because it would really help me. I love your voice. But
Oh my
then
gosh.
on top of that, I love what you say. So I love that interview with Jeff Grognan, Dr. Jeff, and so I reached out to see if you would do an interview with me about fleas.
Yeah.
So here we
Yes.
are.
So here we are talking about those nasty little pests. Well, Jenny, thank you
Yes.
so much for saying that. I really appreciate your kind words. Um, Doing a meditation voice thing would probably help me as well, because we could certainly all use more meditation and Zen in our lives. Um,
Yes.
Thank you. Um, When it comes to fleas, so I think one of the key things is because fleas are something that we deal with. And my perspective and the holistic perspective on fleas is always a healthy animal is the best defense against fleas and parasites. And what constitutes a healthy animal? So there are so many elements to health for our cats and our dogs, that it's about a healthy diet, a healthy lifestyle, um, not having too much stress in their lives, and that includes the stress of individuals, their pet parents that they're living with. We transfer stress onto our animals as well. So there are so many factors that come into play as to why animals get fleas. And even when you have an animal that is on an amazing diet, a species appropriate diet, they don't have, immunological issues that are affecting their immune health and ability to fight off disease and repel parasites. Um, they get time outside, because I feel like that's a big stress for animals as well, not getting enough quality time outside, which is not necessarily just walking on a leash if it's a dog, but taking them somewhere where they really get stimulated and are able to explore their world and sniff and go at their pace and not our pace. When it comes to cats, so you're a cat person, and I'm a cat person too, and a dog person, and an animal person in general. But cats, it's more challenging because we want to let them outside, but we have to keep them safe. So there's a balance of creating a safe outdoor environment for cats where they're not going to fall prey to something, get hit by cars, get in fights with other cats, etc. Um, and be exposed. Again, they're exposed to more stuff when they're out in the world for sure. But that is part of immune health as well. So I always feel like providing a healthy lifestyle includes time outside when and if you can do that safely for cats. So these are kind of the elements of health that reduce the risk of an animal getting flea infestation, parasite infestation, and overall avoiding disease. So that's kind of the first thing, right? It's like, why are they getting fleas? The second thing, if they do get fleas, how do we deal with them? And this is the challenge. A lot of people are using those pesticides, insecticides, or a type of a drug or a pill to avoid fleas. My perspective on that is and the holistic perspective is that these products are extremely toxic. And we know that some animals can have horrific reactions, including seizures. They're neurotoxins. Those insecticides and pesticides are neurotoxins. Not only are they affecting the animal, but when you're putting something on an animal and it says, make sure you wear gloves, don't get it on your hands. If you do get it on your hands, make sure you wash your hands. I mean, we're so careful that we're not going to be affected by these toxins. And why are we putting them on our animals every single month? So a healthy animal is the most important thing. There are natural ways to repel fleas. It's hard to do, natural sprays on cats because they're going to lick it all off, right? But you can do that with dogs. There are different types of natural things you can use in terms of collars and stuff. So whenever you can repel fleas naturally, that's kind of the way to go. But if you do need to use some kind of flea control, if they have fleas and you can't get it under control naturally, then probably the best one to use is Revolution, because Revolution, you can only get it from your vet. It's a drug as opposed to an insecticide. So it gets metabolized a little bit differently. And what I usually recommend is to do one dose and then 1 month later, see if you're getting fleas back. You may only need one dose, but it depends on the extent of the problem and their exposure to fleas and their health in general. But also, if they're not that healthy, then putting an insecticide on them or something on them to control fleas is also going to affect them more deeply. It's going to affect their liver, their kidneys, their overall health. So
I think there's Revolution Plus now, which is not the same as Revolution.
No, it's not. Revolution Plus is much more damaging.
Yes. Okay. Just wanted to make sure that we had that clarity.
So yes, and Revolution also deals with other parasites as well. It gets rid of intestinal parasites. I think I'm not sure if it controls ticks as well, if it's also a tick product. But definitely for fleas, Revolution has been proven to be safer. What you really want to stay away from is the ones that you can buy over the counter from a pet store.
Yes. Yes.
You want something that has a little bit more quality control over it and health studies, etc.
Yeah. Yeah. I had some problems with Revolution with my cats. And that's what basically sent me on a holistic journey.
Okay.
So yeah, and it's interesting because my vet did encourage me to try Revolution Plus, and I was like, no, I don't want to try anything else. But I have a unique situation where my cat Charlie is like a flea magnet, and literally, I know this sounds absurd after 2 years of researching, flea control, but if there's one flea in my yard, it will find Charlie. And it doesn't make any sense that there would only be one, but yeah, he's been on a raw diet for almost 2 years. He's been detoxed. He's, everything that I know to do, and he still gets them. I treat my environment outside. Like it's a very big thing. So part of my interest was to know if you've had any success with homeopathy for fleas.
Yes.
So what and how, and sorry, it's our time to go outside. So he's shown up and is meowing in the background.
Of course.
Yeah.
So dealing with fleas naturally, there is a homeopathic remedy called Pulex irritans, which is made from flea. And the principle of homeopathy is like cures like. So you're giving flea to get rid of fleas. So you're actually giving something internally that will repel fleas. So that's a principle that kind of goes throughout in the same way that we use no-sodes. So remedies made from disease material. organic material, organic disease material, or drugs are actually tautodes, so it's a little bit different. But a nosode made from parvo or made from distemper is used to treat parvo or distemper or any of the like for ticks, for instance, or for heartworm, we actually use a remedy made from heartworm or remedy made from tick to deal with that process in the body and also to repel ticks. So Pulex irritans is the remedy, and what you would do is you would basically give it daily to an animal that is so incredibly prone to fleas. So for Charlie, for instance, you could give a 30C or even a 6C potency daily. And when you're giving a remedy daily, you want to put it in water, like make a dose of the remedy into 30 mil or 60 mils of water, and then just add, half a mil of vodka into that distilled water to keep it from going off. And then you can dose once daily, 0.5 mil along the gums. So principle
I've
of
never heard the
homeopathy.
vodka thing.
Well, you want to use a little bit of alcohol because that water, if it can't go in the fridge. So it's got to sit on the counter because electronics affect homeopathic remedies. You always want to store homeopathic remedies 3 to 4 feet away from any appliances, Wi-Fi, cell phone, microwave, etc. So you can't put it in the fridge. So it's got to sit on the counter. And in order for it to be to remain sterile, because you've got remedy material in there as well, you just want to add a tiny, tiny little bit of vodka just to keep it
Okay.
viable, basically.
Yeah. Huh.
So, and then when you're giving daily dosing, what you do is you get a dropper bottle, and then you need to succuss the bottle 5 times. Succussing is banging on a firm surface or on the palm of your hand 5 times before each dose. So in that way, you can give a remedy daily for a long period of time if you need to, without having what we call a homeopathic proving. So
Yeah.
proving is where you're taking the same dose of a remedy every single day for more than maybe 3 weeks. And
Okay.
then they can start showing the symptoms of the remedy so that we don't want them to start doing that. So you succuss 5 times, and that avoids approving. So that's
Oh,
a way. So this is a way to deal with fleas naturally, to try to get the energy in the body such that fleas are not going to be drawn to your cat or dog.
got
So
it.
we do use this remedy quite frequently with animals who are just super prone to fleas for some reason, which is, yeah.
Yes. Okay. Thank you. Thank you. Thank you. That gives me so much validation because it kind of got irritating to me to just keep hearing, well, like it's the sickest animal, it's the whatever. And I'm like, my sickest animal died. Like he was my sicker animal and he never attracted fleas.
Mm-hmm.
So it can't like I'm like that can't always be the case. It just can't. Like there has to be an exception to the rule.
Mm-hmm.
Almost like, mosquitoes love me, but they don't love my mom. So like there's something either in
Yeah.
my blood or energetically about me that they prefer. So, and my mom's 30 years older than me. So in other words, I'm like, I don't know. I don't know what I was trying to say there, but I was wondering if there was something about Charlie energetically that was like, I'm here, come on in.
Yeah, there
So that
is.
makes sense.
There
Yeah.
is. So the other thing is you can use Pulex irritans, but also treating him constitutionally. So there are remedies that in homeopathy you would look at a case like that and say prone to parasitic infection, prone to parasites, seems to get parasites all the time. And that's something you can repertorize in a homeopathic repertory and take his entire picture into account and find a remedy that has that picture in it. Um, there is also a remedy called Cinna, which is more for intestinal parasites rather than the external types. But Cinna is a remedy we use homeopathically for to rid the body of parasites as well. But that's more like an acute process or even a chronic process that we're using a remedy specifically for that process. Constitutional prescribing in homeopathy can help shift body energy towards a state that may get Charlie out of this state that he just seems to attract fleas.
Okay.
To try to prevent him from being a flea magnet. So a
Yes.
constitutional remedy. Another remedy is sulfur that we use sometimes with animals and also with people or children who tend to really be prone to parasites.
Hmm.
It's yeah, sulfur can be used as well if they also fit the picture. So constitutional prescribing in homeopathy, you're taking all the physical factors into consideration. You're taking the mental state into consideration. You're taking the modalities into consideration. So modalities are what makes them better and what makes them worse. Are they an animal that prefers to be warm, prefers to be chilly, is averse or likes any particular type of weather? What is their nature like? Do they have food? This is more with human homeopathy as opposed to animal homeopathy, because animals aren't eating a whole giant variety of food. But in human homeopathy, you get into food likes and dislikes, preferences for a certain type of behavior. Like, are they super friendly or are they more aloof into themselves? How do they interact in their world? How are they with other animals? Are they particularly aggressive? Are they very docile? Are they shy? So all of these factors come into play in treating constitutionally. And when you factor in this flea magnet issue, so tendency towards parasites, towards attracting parasites, then you come up with a homeopathic remedy that would be constitutional. And then that can help shift that picture.
Okay. Yeah. I mean, homeopathy is so complicated and also so contrary to, how I was raised and all that. Definitely with the like treats like thing, which I
It
kind
is.
of have learned to appreciate. Like if even with raw feeding, if you have like a problem with the spleen, it's not a bad thing to feed spleen.
Mhm.
So,
Yeah,
yes.
that's a Chinese kind of a Chinese medicine principle too.
Yes, yes. Or I'm taking thyroid right now, a bovine thyroid, because my thyroid's a little messed up from menopause. So yes,
Mm,
I've come to appreciate the like treats like because of those situations as well.
right.
Um, so how would you go about, or would you use homeopathy if you got a flea infestation?
So if you have a flea infestation, you can use that. I would probably even use a combination of Cinna, all in low potency. So Cinna probably either in an X potency or maybe a 3C or a 6C. Sulfur in a low potency, X potency, or probably no higher than 6C, and Pulex irritans in a 6C and possibly a 30C as well. And make them all in a combination. Give it once a day orally, and also make it up in a spray bottle, and you can literally spritz the animal down. And you
Mm,
can actually spray any areas that seem to where they sleep, etc., with that. There are also natural sprays that you can use. Um, Sometimes people use diatomaceous earth and they start sprinkling it everywhere, and then their whole house looks like, like a flour bag exploded in the house. A better way to use either diatomaceous earth or boric acid, if you can get it, is to put it in liquid and literally get one of those big sprayers from the garden store that you would usually use to spray Roundup,
yeah.
and fill it with water and add probably like 6 tablespoons of either diatomaceous earth or boric acid, and then dissolve it and literally spray your whole house with it. You can spray it on furniture, you can spray it on the floors. You need to do a really, really very diligent vacuum before you do this, and like really diligent vacuum. and wash all bedding, etc., and then spray this so that it gets into cracks, so that it gets into the side of the wall is oftentimes where fleas they'll go down into cracks. They'll get into carpet fibers. So you want to spray the carpet, you can spray your whole house with it.
Yeah.
So what happens with this is when you spray it, it gets on the flea and it'll also get on the eggs. And the flea has an exoskeleton. And once it dries on the flea, it kind of breaks the exoskeleton apart. So diatomaceous earth and boric acid both have that capacity to do that. So it's a natural way of, instead of using a, a, a pesticide bomb or insecticide bomb in your house where you have to leave your house for a few days, this is a very effective way of getting rid of fleas in the home. Because when you have a flea infestation, if you caught it early, like you've caught a flea or two on your animal, you can usually get it under control by either flea combing a cat regularly and getting rid of the fleas, or bathing them. And you don't need a flea shampoo. You just need a really good mild shampoo, but you have to let them sit in the suds for about 10 minutes, and that actually kills the fleas. So that's a way of getting rid of fleas on the animal. Bathing cats is not always the easiest thing to do, so flea combing is your other option, right?
Yes. Yeah. I actually last year put Charlie in an Epsom salt bath.
Oh, wow.
And it worked really, really well. Like the fleas came off and he was super relaxed in it, I think because of the magnesium.
Right.
But then the drying process was insane and wasn't worth it. So yeah. So I learned that you can do Epsom salts too, which is great.
Yeah. Yeah, I think Epsom salts would have it. Well, it's a type of salt, a type of sodium, right? Epsom salt.
Yes.
Or magnesium sulfate, isn't it?
Yes, it's magnesium sulfate. Yeah.
So that probably has a similar kind of effect.
Yes, yes, drying out, yeah.
Drying out the exoskeleton of the flea.
Yes, yes. Yeah. And I have had the diatomaceous cloud in my house. Yes. 1 year, I think it was last year, I lost my power for 3 days while we had a flea infestation.
Oh, lovely.
So I could not vacuum. So I had to put diatomaceous earth everywhere, and it was awful. So, yes, I'm familiar with that one.
It doesn't work that well when you're putting it down dry. It doesn't seep in the way it needs to, penetrate.
Yeah. Yeah. I love that suggestion about the pump sprayer. Really well. Yes. Yes. That's brilliant.
And there are also things like orange oil that you can add into it, lavender, citronella, all of the essential oil types or herbs that are repellent to fleas. That's something you don't want to spray on your animal, and you want to let it dry before. I mean, you can actually use those kinds of things on dogs in a highly diluted, but on cats, they're gonna lick.
Yes.
Gonna lick everything off and ingest it. So that's not such a good idea.
So you're suggesting to put the essential oils in that sprayer?
You can put some essential oil in the sprayer as well.
Okay. Yeah. I get worried about essential oils with cats.
Yes.
And people listening to this and just, going to town with a bunch of drops. So that's why.
No, you can't do that.
Yeah. I would just want to caution people to do that unless you know what you're doing.
Yeah.
Because I think that can be dangerous too. And the reason I say that is I mean, both of my cats were affected by my overuse of diatomaceous earth because I had no idea what I was doing. And it is, if you've never had a flea infestation, it is the most maddening thing in the world. And mine was mild, but it felt like it was really, really strong because of how Charlie reacts to it. And I mean, just getting it under control is just a nightmare. So you tend to give up and just say, screw it, I don't care. I'm just gonna put this crap everywhere. But then you can end up having a problem where they're really affected. Like Charlie can barely even handle diatomaceous earth now because he's been so overdosed with it
What's his
from last year.
reaction to it?
He has an extreme histamine reaction to very many things.
Hmm.
And his extreme histamine reaction creates bubbles in his neck, around his ears, and above his eyes, and then he starts to bobble his head from the histamine.
Wow.
Yeah. So it's a lot.
Huh.
So, okay, so then let's say I've noticed that Charlie also has, if he gets fleas and they're present and on him, then he has the toxins like the histamines in his body from that. Are there
Hmm.
also homeopathic remedies that you would recommend for after a flea infestation?
After a flea infestation to deal with does he get, you mean bites on his body and stuff like that? Or he's reacting to whatever you're using against the fleas?
No, not well, it could be both, I guess. But basically to like rid his body from what the fleas put in it, I guess. I don't really understand what they put in it, but I know.
Fleas don't usually transmit anything into the body. I mean, they are a sucking animal, just like
Yeah.
lice are. Ticks can transmit disease, and
Yes.
you know, ticks are a vector for a number of awful things, including Lyme and other horrible things you don't want to get. Um, does he actually react to when he gets a flea bite? Does he have really bad reactions to flea bites?
I don't know because I don't know. It's hard because he has so many reactions to so many environmental things. I don't
Hmm.
know if it's fleas or not, and I don't know when he's been bitten or not because his hair is like this long from his body. So
Hmm.
I have no way of knowing. I don't feel like bites or anything, but
Hmm. Okay.
yeah.
So Pulex would be the remedy to use for after there is a flea infestation and you know that he's been exposed to that. And is that him?
That's him. He
That's
says, I
funny.
know you're talking about me.
Aw, hey, Charlie. Hi, Charlie. Oh,
And
he's cute. Look at the little diamond thing on his
I know. Hold on.
face.
Well, why is it there he is. He turns 15 tomorrow.
Oh my gosh.
Yes.
He's cute. Is he a ragdoll or what's that other
Uh
breed?
he is a ragdoll,
He's a
yes.
ragdoll. Yeah.
Here.
Yeah.
I'm sorry, I know.
Oh,
There
there
he
you go.
is.
So we can see him better. Hey, buddy.
You doing all right? Okay, we're talking about fleas.
He's looking right at the camera.
I
Hi,
know.
Charlie.
He's a very engaged cat.
Is he?
Hmm.
Hmm.
Thank you. Okay, there you go.
So yes, after a flea infestation, Pulex, definitely the remedy. Pulex irritans. You can also use something like histaminum because he gets all this histamine response, right? Two
Yes.
remedies we use very commonly for allergic reactions, flea bites. Well, Pulex is good for flea bites, but also bee stings, mosquito bites, any bites where there's inflammation and redness around the bite area. Apis, Apis mellifica, which is made from bee, and
Yes.
histaminum, which is made from histamine. So that's a nosode, histaminum. So those two remedies can be used in combination to tone down that allergic response in the body.
Okay. When I was interviewing Julianne Lee one time, we got on the topic of fleas. It's one of my favorite things to talk about. Not really, but I'm sort of obsessed given Charlie. And she recommended Grindella. Do
Hmm.
you know why she would have recommended Grindella?
Grindelia. Yeah, that's another really good remedy for it. Was she talking about fleas with Charlie or specifically for
Yes, we
fleas?
were talking about fleas for Charlie. Yes.
Yeah, that can be another really good remedy for um tendency towards attracting parasites and also the picture of a flea bite, the reaction. So there are many, many remedies. Rust ox is another remedy that can be really good for that type of a thing. So Grindelia is another remedy. When you're doing homeopathy, so I'm just telling you sort of the generalized remedies.
Yes.
Grindelia, she would have probably, you might have said something about Charlie that triggered her to think of that remedy.
Okay.
So I'm not sure why she thought of that specifically, but yes, that's another potential remedy to be used.
Yes, that's what's so, I mean, mind-boggling about homeopathy is like which one and for how,
Mhm.
like what potency and for how long and then also most recently I've encountered the controversy, if you will, of classical homeopathy versus whatever the other one's called, but the combination remedies. And I had a classical homeopath warning me that the proving, or that I'd be proving by giving a cat, or giving Charlie rather, um, a combination remedy for several days. And you've explained to me in this interview how that wouldn't have happened, but I didn't know how to. So you are classically trained, correct?
I am, yes.
But you're not opposed to a combination remedy if it warrants it for the animal, or if the animal warrants it.
I'm not opposed, and I oftentimes do use combination remedies, but I use combination remedies that are specific to that individual. Julianne Lee and I worked together in veterinary clinics for 15 years together. And Julie graduated from homeopathic college and became a human homeopath. And then she went and did training in India, in the UK, in Greece with very famous homeopaths, and actually learned more specifically how to do homeopathy with animals. And she discovered in practice that classical homeopathy has definitely has a place, and constitutional prescribing classical homeopathy, where you find one remedy for that individual, which covers the entire picture of that animal or human being or individual. She was finding that with animals, it's harder to find that one remedy because they can't speak to you. They can't tell you those fine details of how they feel, what makes them better, what makes them worse, how they feel mentally and emotionally, what their history is. When you take a human case, it's usually a 2.5 to 3 hour consultation. And you're going back to childhood. You're delving into their childhood wounds, how they grew up, how they were in school, what their family life was like, where they fell into the family dynamic and how their reaction was. Because oftentimes the seeds of disease start in childhood with our first traumas. And those are things we then carry through our lives. And they mold and dictate our behaviors in our lives. So childhood wounds do that, experiences in life, traumas in life, whether physical traumas or emotional traumas, our relationships, our baggage that we carry, right? So a human
Mm.
being can sit and talk about, or sometimes they can't, but people can explain what's happened in their life. People can talk to you about every fine detail as a case opens up, and then you have all the information to treat classically and to treat constitutionally. It's really difficult to do that with an animal. So, so what Julianne found in practice, and then what I also learned from her, and what we also learned as we went through the College of Homeopathic Medicine, which was her founding college, and those of us who graduated from it, and me working alongside her in practice in clinic, what she found was, and this is how I practice now as well, I still treat constitutionally, but then we can use remedies for specific pathology. So with things like arthritis, thyroid disease, either hypo or hyperthyroidism, kidney disease, all the different pathologies with animals, we can use lower potency remedies, or sometimes if the pathology is really intense, a combination of low potency and higher potency, where we're trying to control pain or really shift the picture of disease in that animal. Combination remedies that are specific to that animal for their specific pathology, but you're also treating constitutionally. And it worked much more effectively. It's why Julie was so successful in her practice, and why I feel I have better success as well, because there's not really a name for this kind of homeopathy. Julie always called it functional. It's like functional medicine.
Yeah.
Kind of that kind of a principle.
Yes. I prefer that approach. I think just common sense wise for me, and based on Charlie's situation. Like, I don't have time to wait to see if that remedy is gonna like work out or not. Like, I got to get this fixed
Yes.
now, because he just keeps, becoming more reactive if I don't get it under control. So that's why I prefer. I think like I can appreciate both approaches, but in my situation with a chronic situation, or repetitively, I want something that's going to be a little more effective. So it's almost like, to me, like a fishnet,
Yeah.
like throwing it out to get all the fish rather than one line to get one fish.
One fish.
Yeah.
Exactly.
Yeah.
You made a really good point there, is that you don't have the time to wait to give one remedy, because classical homeopathy would give a remedy and then you would probably wait 4 to 6 weeks.
Yes.
And then reassess, see the remedy reaction. With animals, it's very different because their lifespan is a lot shorter. You often don't have time to wait that long. Sometimes we're dealing with animals that people are coming to us with animals who conventional medicine has given up on.
Yes.
And this is also my origin story of
Yes.
how I came
That's
to
why I
homeopathy,
smiled.
because my vet had given up on my dog, and I wasn't ready to give up on my dog. And at 16 years old, he lived another 2 years with Julianne Lee and the holistic vets that she was working with help, and put my 16-year-old dog on a raw food diet and treated him homeopathically and naturopath, so supplements. So I was completely blown away. And we were changing remedies really quickly, and we had him on a combination of remedies as well, because he had liver failure and kidney failure and dementia, and stopped eating, and all these, his body was basically breaking down. He couldn't even stand up. He would just fall over. So to get back to health and live another 2 years to age 18 was an astounding example of the power of homeopathy and holistic medicine. So you don't have time. Animals can get better quicker. They can also regress more quickly. So sometimes you need to cycle through remedies fairly quickly when there's something intense going on or something acute. With chronic disease, you usually have a bit more time, but then they can have exacerbations in their state of health, where, if a cat's not eating, you can't like not let them eat for a week. You've got to get something that's going to shift, and you have to work through those remedies fairly quickly. Or because you don't know the reason why they're not eating, because they can't tell you what's making them
Yes.
sick. We can only go by what we know their chronic issues are and by their behavior. So you might have to use a combination of like 2 or 3 or 4 remedies that are the highest for everything you think might be going on, to try to really shift that around. Because if you wait and do one remedy, give a few doses, wait a couple of days, do the next remedy, because that's not working, do the next remedy, by the time you're going to have to take your cat into the vet, and you're going to have to be force fed by that time.
Yes. Yes.
Right?
Exactly.
So you're
Yeah.
completely right. In animal homeopathy is very different from human homeopathy. There are so many parallels, yes, but you don't have the same benefit of time.
Yeah.
And people can also go to their doctor, and they're usually under medical care as well. And people can also help themselves. We have the ability to make choices for ourselves, to either go to a pharmacy or go to a natural health store and speak to somebody and say, hey, what can I take for this? This is what's going on. Somebody who's knowledgeable. With our animals, we can go to our veterinarian, and if you have a holistic veterinarian that practices homeopathy or does Chinese medicine or does acupuncture or does holistic modalities, then fabulous. But they're getting fewer and farther between to find these people. And many of them, what's happening in our, in our society here is a lot of those holistic vets are retiring and they're being replaced by conventionally trained vets who are not practicing the same level of holistic medicine. Or several of the holistic clinics in this area have been taken over by a conglomerate. And the clinic stays holistic for a year or two, and then gradually they become extremely conventional. Where the bottom line, sadly, is how much money they're bringing in.
Yes.
And holistic medicine can bring in a lot of money, but you need to give those practitioners the time to do holistic medicine. And
Yes.
you need an hour for your first consultation.
Yes.
The veterinarian gets 15 minutes with a patient, and then they have to do their next patient.
Right. Yeah.
So homeopathy, you can't do homeopathy like that.
No. No. So speaking of homeopathy, how would someone, if I am a pet owner and want to work with a homeopath for my cat, where do you go? How do you?
Well, you need to either try to find a veterinarian who's actually qualified in homeopathy, so that they've taken more than a 6 or 8 week program in homeopathy. Depending on whether you're in Canada or the States or elsewhere in the world, you might be able to find a website that lets you know what veterinarians are holistic and are doing homeopathy. Or you could find a human homeopath that does animal homeopathy, and there aren't a whole lot of them out there either, and work with your veterinarian and that homeopath. The regulations around homeopathy are that a homeopath is to be working in a clinic environment under the supervision of a veterinarian. There are some veterinarians that are referring to a homeopath that they trust or have worked with in the past. In our jurisdiction here in British Columbia, Canada, technically they're not supposed to be doing that. So to follow the regulations, a homeopath is supposed to be working in clinic. But if you find a veterinarian that's open to doing homeopathy, then there's room to work with that veterinarian and find somebody qualified to do homeopathy.
Okay. And then you have a course though, right? As
Yes,
well? Okay.
I do. So finding a homeopath is one thing, but what I'm endeavoring to do is to give people more knowledge and education so that they're able to use homeopathy effectively and safely at home. So the course that I run is a 40-hour program. It provides the foundation of understanding of homeopathy, the history of homeopathy, how to repertorize. So I talked to you about finding that remedy that fits the whole picture, or finding remedies that work in a acute illness or injury. And I teach people how to repertorize, how a homeopath finds these remedies. And with a few books that you could have at home, I teach you how to use that. So learning how to actually use homeopathy and understanding the fundamentals and the principles of homeopathy is really important. And having hands-on tools that you can use at home. And also, I go through virtually every injury process and every acute illness process. So the course is acute and first aid homeopathy for animals, which is dogs and cats. And it's called your homeopathic toolkit. And so then I go through all the different illnesses and injuries, and then what remedies we can use to treat, and what potency to use, how often to repeat, when it's time to change remedies, and assessing a remedy reaction, knowing when to move on to the next remedy or stay with that remedy. So there's a lot to learn about homeopathy, and it can be very complicated, but for acute illness and injury, I feel like a lot of people can learn how to deal with these things at home so that they don't
Yes.
have to run to the vet every time. Also, what I go through is some basic anatomy and physiology and pathology with relation to these various illnesses and injuries, acute illnesses and injuries, so that you also can assess your animal's vital signs to know when you actually have to go to emergency right away, when you can give it 24 hours to see if remedies will work, or when you need to see your regular veterinarian. So it's being able to assess vital signs. What's actually an emergency? Because half the time we it's like, I don't know what's going on. Their breathing is funny. They're assessing gum color, assessing respiratory rate, being able to assess yourself and have better confidence and better tools at home to be able to deal with stuff at home and know when you have to go to the vet. And when you're at the vet office, having more knowledge and expertise so that you're not just relying completely on the veterinarian. So what I also go through is basic understanding of blood work and diagnostics,
Mm,
so that you know what all the numbers mean. You know what the numbers are in kidney disease, in thyroid illness, with anemia, uh, with the red blood cells and white blood cells, all those inflammatory cells in the body. Um, yeah, so that you're not completely in the dark. And then your
yes.
veterinarian also understands, okay, this person actually has some knowledge. I'm not just speaking to somebody who has no idea what anything is.
That's really great. Especially because that's kind of some things that I just went through with the death of my other cat.
So
That I
sorry.
honestly thinks, I honestly thought he was constipated, and that's why he wasn't eating, and we were going to the vet the next day anyway for routine blood work, and so I
Mhm.
didn't think much of it. I had stopped giving him supplements because I felt like he had asked me to do that. So I wasn't looking in his mouth anymore because I wasn't opening it
Mhm.
every day. And he was yellow when we got to the vet office, and I didn't know that he was yellow until my vet told me that he was.
So he was in
So,
liver failure,
well, yes.
jaundice? Yeah.
Yes, he was jaundice, and they think it was lymphoma. But yes, liver, spleen, yes, it was nasty.
Hmm.
So, um, but they first thought it was pancreatitis. So I, treated him at home for all of that, and he just progressively got worse. Um, I don't want to talk too much about it because I might cry.
Yeah. No.
So, but now I'm like, I'm never not looking in a mouth again. So it's unfortunate that I had to learn it that way because I don't think it would have changed the outcome of what happened, but I could have probably brought him in a day earlier or something like that.
Hmm.
So I think that that's really valuable information based on my most recent experience. Um,
Yeah.
and and yes, just in general, like there have been situations where my sister, for example, just she travels with her. She has a German short-haired pointer. I was going to say GSP, and she travels with him to do dock diving competitions. Are you
Mm.
familiar with those?
Hmm.
So he had pancreatitis on the way to their last, and she ended up with some vet she didn't know, needing to treat him. So again, I think that just having that general knowledge is so important.
Hmm.
Is your course self-paced, or is it you have to show up on time for
It's
like do you
self-directed, so all of
okay.
the lessons are recorded. There is a live at the beginning of every weekend. So the way I structure it is it's one weekend a month for 4 months, and it's a Saturday and a Sunday. So at the beginning of the Saturday of each weekend, I do a live because I can answer questions. It also depends on how big the class is. So
Yes.
in a live, I might not do question and answer depending on how many people there are. But What I'll do is I'll just do a rundown and a recap of what's coming up. If anybody has any really burning questions, they can ask them at that time. And then people can take the lessons that are released in a drip format. So the first weekend it starts October 19th. So the first weekend's lessons are released on October 19th of the morning. We do a live to open up, and then you can watch those lessons at your own pace. However, there is some homework to do. There is some reading to do. There are some books to get ahead of the course as well that are needed for learning and reading. And I recommend that people try to get through the lessons in a decent amount of time, like probably within the 2 weeks following, or even a week following, because then you're going to have more lessons the next time. So it's kind of set up that you watch the lessons and then you do the homework, and then you don't get too far behind for the next weekend.
Got it.
Because there is a quiz at the end as well. It's more of a just kind of a test of knowledge at the end of the program.
Right. Make sure you're absorbing or understanding things. Yeah. Nice.
But there are also people that decide to just take it at their own pace.
Okay. So that's possible.
Which is also beneficial, but you don't, and the lives are downloaded and then you can watch the live afterwards.
Oh.
And then, if there's any real questions that need to be answered, I'm available on email as well.
Okay.
Yeah.
Super. Anything else flea-wise that you want to cover with homeopathy?
I think we covered most everything with fleas as to why animals get fleas, how to treat fleas naturally. If you do end up having to use, because sometimes in multiple animal households,
yes,
it can be really challenging.
Yes.
So I have quite a few animals, and if I get a flea infestation, it's going to be a bit of a disaster, because then they just keep on passing it from one to the other, right? So if you do need to use some kind of flea control, I still feel like Revolution is a safer one. Advantage is the other one. Those are the two that you would get from a veterinarian. And if you're needing to do it, then you can do a homeopathic remedy afterwards to help them detox and avoid any of the negative consequences. And that is Nux vomica.
Okay.
So Nux vomica is really good for toxic insult. So Nux vomica 30C given immediately after you put the drops on. And then I would do it every 6 hours for 3 doses, every 6 to 8 hours for 3 doses. And that's going to help detox and avoid any toxicity from that.
Oh, nice. Okay.
So that's helpful cool. If and when you do need to use something other than natural means.
Yes.
Yeah.
Yes. Okay. Well, thank you very much.
You're welcome very much.
I really appreciate it.
You're welcome. I also wanted to say that anybody watching your program, if they do want to take my course, I can offer a 10% discount for them.
Okay.
And then we can provide the link for the course if you like. And if they use the code Floppy10,
okay,
they can apply that code for a 10% discount on the course.
Okay. I will. I'm going to include, sorry, I should have mentioned that. Thank you for the reminder. I will include a link to your website and also the course link as well. And then I'll put the code as well.
Great.
All right. Thank you so much.
You're welcome, Jenny. So nice to see you and talk about stuff and help people.
Yes. Bye.